HIV has been around for decades, and many of us know the risks of needle use and unprotected sex. In 2022 and 2023, Manitoba recorded its highest rates ever of new HIV cases, and for the first, more women than men were newly diagnosed. Still to this day, there are so many stigmas attached to HIV, and University of Manitoba researchers are trying to break down those stereotypes. Joining us now is Associate Professor of the Max Rady College of Medicine's Medical Microbiology and Infectious Diseases, Dr. Zulma Rueda, and pardon the pronouncer there. Good morning, doctor. Thank you for joining us.
Good morning. Thank you for having me.
So please tell us what you're seeing in terms of new HIV infections in Manitoba and in which populations you're seeing these disturbing numbers.
In 2022 and 2023, this is not new. This has been happening since 2018. Yes. In 2022, can you hear me? Sorry?
Yes, go ahead.
Okay, sorry. In 2022 and 2023, Manitoba recorded its highest ever HIV incidence in the history of the province. For the first time, more women than men were diagnosed. Unfortunately, there is an overrepresentation of Indigenous people, women, people who use drugs. And this shift is alarming and highlights the needs for urgent and community-driven responses.
And it's not just an increase in HIV, you're also seeing a rise in other infections like syphilis, chlamydia, gonorrhea. Tell us more about what you're seeing.
That is a very important question because the main mode of HIV transmission is sexually, and there are other sexually transmitted and blood-borne infections that can be transmitted through sexual intercourse. So among those, the most common that we have seen is syphilis, chlamydia, gonorrhea, human papillomaviruses, and other sexually transmitted and blood-borne infections. So one important thing is because they shared a common mode of transmission, which is through sexual intercourse. When a person is diagnosed with one of those, the idea is that if you test for one, test for all.
Mm-hmm. And with that day today being Zero Stigma Day, what's the most common stigma you're seeing?
One of the main and most important things is related to the person and related to the community. So related to the person is that the person feel self-stigma, which means start to criticize themselves for their choices. And from the community, family members, loved ones, people sometimes reject people, sometimes discriminate, and sometimes there are still concerning taboos that are not true. For example, that HIV can be transmitted through sharing food or through sharing plates. So those are not possible routes of transmission. So one of the things that we want to highlight today is three main messages. HIV is preventable. Tools like pre-exposure prophylaxis and post-exposure prophylaxis are highly effective when taken as prescribed. The second important thing is an HIV diagnosis is not a death sentence. With treatment, we have highly effective treatment. People can live long, healthy lives and cannot transmit the virus if the viral load is undetectable. We cannot detect the virus in blood. And testing saves lives. So it's quick, confidential, and is a powerful step toward ending stigma. Know your HIV status, your sexually transmitted and blood-borne infection status, so you can receive treatment or you can receive prevention treatment.
Doctor, I'm so sorry to cut you off. We're simply out of time.